Good afternoon. Welcome to the HSE weekly press briefing. Could I ask the speakers first, please, to introduce themselves from the left?
Niamh O'Byrne, National Lead for Testing and Tracing.
Liam Woods, Director of Acute Operations.
Lucy Jessup, the Director of Public Health at the National Immunisation Office.
Paul Reid, CEO.
And I'm Mark Brannock, National Director of Communications, and Michael and Bernadette are our Irish Sign Language interpreters. This press briefing is being broadcast on the RTE News channel and on the HSE Twitter feed. Could I ask Paul first, please, to give his weekly update?
Thank you, Mark. Good afternoon, everybody. The vaccination campaign is definitely in its final leg of a programme that has been delivered safely, at pace, and with massive buy-in from the Irish population. We've now over 3 million people fully vaccinated here in Ireland. By this weekend, 90% of adults will be partially vaccinated and 80% of adults will be fully vaccinated. These are really, truly momentous milestones. From today, as you will all be aware, people aged 12 to 15 can register online to be vaccinated, and many of these will be administered this weekend. Indeed, many will have already received appointments to be vaccinated this weekend. Very encouragingly, by mid-morning this morning, over 42,000 children of age 12 to 15 have been registered on the online system today. And just a small proportion of these, 700 of those, were through our HSE call line. So vast majority, 42,000 registered this morning. This is likely to be the last of the age groups for which we open registration during this campaign, and that's a remarkable position that we now find ourselves in. All of the evidence demonstrates huge benefits to date, which is clearly demonstrated in reduced illness, reduced hospitalizations, reduced ICU, and the fact that it has also saved lives. Importantly, after a horrendous 17 months of uncertainty and sometimes fear for people, the vaccination programme has served to facilitate the reopening of society, the economy, and equally important, it's given the Irish people back a strong level of pride, hope, and indeed confidence. I just want to touch briefly on our hospital situation and come back to it in a bit more detail. But along with all other healthcare administrations, our healthcare system has taken a huge impact in terms of non-COVID care. Past 17 months has significantly impacted on a wide range of our health services. Along with this, we had quite a catastrophic impact from the cyber attack in the middle of May. We are seeing the impacts of this now in our hospital activity levels. But I do want to assure we've been working hard, along with our supports for COVID, to develop plans to tackle the delayed impacts that we've seen over the past 17 months through COVID. We're finalising the utilisation of an access to care fund that will encompass increasing our capacity in the public health system, increasing utilisation of capacity in the private health system, along with other initiatives supported by the NTPF. This fund of €210 million provided in the National Service Plan, the Access to Care Fund. We're finalising some details with the board of the HSE, the Minister and the Department on the best use of the available funds towards the end of this year. But do want to assure the public we do care and we will work relentlessly on this. And I ask the public to understand that this will take a sustained period of time of recovery. This will not be solved overnight. Just brief mention of where we are seeing transmission levels related to the virus at the moment. Notwithstanding the strong levels of success I just outlined from the vaccination programme, we're still in a period of sustained threat from the Delta variant and the virus itself. Case numbers are rising, exhibiting signs of stabilisation last week, but a 30% increase over the last 7 days compared to a 2% increase the 7 days prior to that. So again, I strongly urge everyone, the public, stick with the public health measures, continue to come forward for a vaccination, protect yourself, your family and friends. People are still being admitted to hospital with COVID-19 and people are still getting very sick with COVID. Just on our hospitals, they are extremely busy. In relation to those further challenges, you'll all know what has driven a lot of demand, a lot of care that may have been left for some time by many people and now coming forward for non-COVID care. Many of our hospitals face significant pressures, not just from COVID, but from non-COVID services now as well. So while COVID is a factor, we know that delayed care is a significant factor, particularly demonstrating itself in attendances and on ED, emergency departments at the moment. In addition, GPs around the country have been extremely busy and are still extremely busy. And some patients who might normal times have access to their GP may have symptoms and are now coming directly into our emergency departments. So our message again is the same as always. Please come to our A&E if you are in need of urgent emergency care. But if you're not, please do try seek a consultation from your GP, your pharmacy, or indeed through one of our local minor injury units. The numbers of people in COVID-19 in hospital continues to rise, and we do project to see that continuing to rise throughout August and indeed into September. Today, we're now at 219 people in hospital, which is up 15% on the same day last week. We had 36 people in ICU, which is up from 30 the previous week, so a 20% increase overall. Hospitalizations and vaccination status. I mentioned last week that we were capturing manually some data to give us a greater insight into the Delta variant around the number of issues in hospitalization, age, and vaccinations. It is still very much a manual process, and it's from a point in time. And I'll bring you through some of the detail on that. But just to give some summary information messages coming from it up front. And the first one is that the proportion of all hospital admissions from COVID who are not fully vaccinated, it is high in proportion to the population who are not fully vaccinated. So high in proportion of those that aren't vaccinated. However, the proportion of those patients who are admitted to hospital who are fully vaccinated will inevitably rise as more and more of the population becomes fully vaccinated. Of the hospitalized COVID-19 cases, most are people who require hospital care for the disease itself, COVID-19. And of the total hospitalized cases, a small percentage are either asymptomatic and infectious or asymptomatic and no longer infectious categories. And we can give some brief detail on that. Where hospital outbreaks are occurring now, a much higher proportion of the infected individuals detected are fully vaccinated and asymptomatic, compared to the impacts that we saw in January of 2021. The impact of the vaccination programme is most striking in relation to ICU admissions. A very high percentage of patients being admitted to ICU, ranging in a range of between 76 to 80%, are not fully vaccinated patients. And in terms of mortality, which I again bring through a little bit more detail, over a period of time, 150 confirmed COVID-19 deaths over a period of time. Just 26 had received recommended doses, but again, I'll give you some further detail on that shortly. In terms of hospitalised cases and ages, just to give you a quick snapshot on each of these, and again, these are at a point in time. A snapshot from this week of hospitalised cases and ages. 60% of the hospitalised cases were over the ages of 50 years. 33% of the hospitalised cases were between the ages of 19 to 49. And 7% of the hospitalised cases were between the years 0 to 18. In terms of ICU and ages, again, a snapshot over last week, 58% of the ICU cases were 50 years and over. 48% of ICU cases were between the ages of 19 to 49. There were no cases last week in the ages of 0 to 18. In terms of length of stay in hospital, we just looked at a period of 151 patients who were discharged between the 31st of July and the 10th of August to give us some indication. The average length of stay was 6.5 days, with an average patient age of 41 years of age. But indeed, the age range of those discharged can vary from 0 to 92 years of age. In terms of the length of stay in ICU, the average length of stay in ICU is 18 days. But length of stay in ICU, again, can range from 1 day to 91 days. On vaccination status in hospital, and again, a snapshot of the 206 people for this week, 51% of the hospitalised cases aren't vaccinated, which again is high in proportion to 25% of the population at that point in time who hadn't been vaccinated. And 49% are fully vaccinated. And again, make the point, we do expect to see those proportions rise as more people are vaccinated. On the vaccination status in ICU, again, a snapshot of this week. 58% of ICU cases aren't vaccinated at all. Again, high in proportion to the population, 25%. 18% are partially vaccinated and 24% are fully vaccinated. A quick snapshot of period of vaccination and status on ICU over a period of time between the 1st of April and the 7th of August 2021. 169 adults aged 15 years and over were reported as admitted to ICU were confirmed with a COVID-19 infection. We only have 160 of those ICU admissions with confirmed vaccination data available to us. Of those 160, 36 cases were recorded as having received a COVID-19 vaccine. That's either 1 or 2 doses. But just 6 people had been fully protected. That is, they've had their full 2 doses and the period of 14 days after. In terms of hospitalisation cases and COVID, again, a snapshot, 92%, this is in relation to COVID cases in hospital of the total number of 203 when we did this analysis. 92% of the cases admitted with COVID are now being treated for COVID. 8% identified with COVID, but are asymptomatic and not infectious. But again, they will be monitored through their stay for COVID, along with other illness. And deaths in COVID, I think this figure has been reported, but just to restate again, in a period of 155 laboratory confirmed COVID-19 deaths notified to the HPSC between the 1st of April and the 7th of August. 150 of these deaths we have the vaccination data for. 62 deaths were reported in persons having received at least 1 dose of COVID-19 vaccine prior to death. And again, just 7 were reported in persons who were fully protected, that is, 2 doses and the 14-day period post, or the relevant period post. Summary messages through all of that, again, from myself, just to state it. The vaccination programme is significantly supporting reduced illness, hospitalisations, ICU and mortality. And the majority of people with COVID in hospital are being treated for COVID. A smaller number are being treated for another illness, but again, being monitored for COVID. Just to give you a kind of quick status update on the vaccination programme overall. It's not long ago, I know things have moved fast since Stephen's Day, when we stood in a warehouse in the south side of Dublin, looking at a couple of boxes containing less than 10,000 Pfizer vaccines, the first to arrive in the country. We were all concerned there now how supply would improve and how much the uptake would be in Ireland to protect the public overall. But we've been greatly surprised. Supply lines have significantly improved and become consistent, and the uptake, I think, has more than met all of our expectations. And over those past 8 months, we've seen vaccinations take place by GPs, who played a great role in the vaccination programme, by community vaccination teams, national ambulance services, pharmacies, and indeed the vaccination centres. And I do want to take the time, just in saying all that, to thank everybody who's been involved in the vaccination programme as we continue on to the final leg of this phase anyway. I'm nothing more than proud of everybody who's been involved in it right across the health system, directly or indirectly. Just to give a quick status of where we are now on the total administered vaccines. We've now administered over 6.23 million vaccines. 3.37 million adults have received a dose 1, over 89% of the population, and almost 3 million adults have received their second dose or single dose, which is over 79% of adults. My colleague Lucy Jessup will cover the uptake in her slides, but just to close by saying last week we administered over 228,000 vaccines administered. This week, the week we're in right now, commencing the 9th of August, the plan is to administer over 200,000. And next week, a similar plan again on the week commencing the 16th of August. I'd now like to pass you across to my colleague, Ms. Lucy Jessup. Thank you.
Thank you very much. Yes, we just wanted to cover the COVID vaccines in a little bit more detail, and particularly to talk about the 12 to 15-year-old programme. So as Mr. Reid has covered already in terms of the vaccine programme, I did just want to highlight how far we have come. So at the moment, approximately 4.5 billion doses of COVID-19 vaccines have been given across the world in the past 8 months. So this was a disease we didn't even know about 2 years ago. We've developed the vaccine, manufactured the vaccine, distributed it, and administered it to 4.5 billion people across the world. So that's a huge achievement worldwide. And about 30% of the world's population have had at least one dose, and nearly 16% of the world's population are fully vaccinated. So that's a huge, has already been said, a huge effort across the world for all this, the vaccine programme. And indeed in Ireland, an amazing effort across the whole of the health service. 6.2 million doses administered, and now nearly 90% of the adult population at least one dose, and nearly 80% fully vaccinated. So it has been a major challenge. Obviously, as was mentioned, the vaccines, when they first arrive, they're kept in very difficult conditions at very low temperatures. They're in multi-dose vials, so it has been challenging to roll out the programme, but the programme has been extremely successful across all the areas who have been administering the vaccine. So it has been a great achievement already in terms of what we've done for the programme. And we can see in terms of registrations for the vaccine programme, the vast majority of the population have registered for vaccine. So 91% of people 16 years and over have registered for vaccination in Ireland. You can see for the older age groups, it's virtually 100% at this point. And we're down to even those in their 30s, nearly 90%. Those 18 to 29, 81%, and 16 to 17-year-olds, 66% of them have now registered for vaccination. And we only opened that portal a couple of weeks ago. So that's a really, really encouraging uptake of people. Obviously, it's summer holiday time. You know, people may take a little bit longer to register on the portal, but that's an extremely high uptake for those younger people where the portal has only been open for a short period of time. And we can see here for the vaccinations, the actual vaccinations of the age groups, that has really mirrored in terms of those people who have registered, have come forward to be vaccinated, and even down to the 16 to 17s, we've now vaccinated with first vaccine 61% of those people in the 16 to 17 age group. And as we've said, nearly 90% partially vaccinated and nearly 80% fully vaccinated in the adult population. So I just wanted to move on just to cover in a little bit more detail the 12 to 15-year-old programme. So this is following a recommendation from the National Immunisation Advisory Committee. The registration portal opened now for the 12 to 15-year-olds. So our European Medicines Agency licensed the Pfizer vaccine, the Maternity vaccine, in June of this year for those aged 12 years and over. And more recently, they've also licensed Spikevax or Moderna vaccine for those 12 years and over. But actually, the American version of NIAC, the ACIP, have recommended the use of the Pfizer vaccine since May of this year for those over 12, those 12 years and over. And in America, over 40% of those over 12 have received one dose of vaccine. And in France, where this has also been offered in 12 to 17-year-olds for a little while, 50% of those 12 to 17-year-olds in France have had a first dose. So this has been rolled out across many countries in the world already in terms of their adolescents, 12 to 15. So as the HSE, we're now offering 2 doses of mRNA vaccine. So that's the Pfizer vaccine in the main, and also the Moderna vaccine with a 3 to 4 week interval between the 2 doses. So the vaccine is strongly recommended for young people who have underlying medical conditions that might put them at increased risk of severe COVID-19 disease. And we're also strongly recommending it for young people who live with people who are at increased risk of COVID-19 disease. And we'd strongly encourage parents to look at all the information that we have on the hse.ie website on the benefits and risks of the vaccine, and discuss as a family all the information that we have to make sure you make the right decision for your child. So thinking about the risks of COVID-19 disease for children, we know the overall risks of COVID-19 disease for those under 19 without underlying conditions are low. And in Ireland, the rate of hospitalizations for children under 19 without underlying medical conditions is less than 1 in 100,000. And of those children who have been admitted to hospital, 7 out of 10 children have chronic health conditions. There is also a rare condition after COVID-19 disease called multi-system inflammatory syndrome, which can be quite serious. And also, although most children will recover quite quickly, some will get prolonged symptoms for weeks or months, and that's known as long COVID. It is rare in children, but it does happen. There are also, as we all know, the psychosocial impacts on children. So children have been affected by the indirect effects of COVID-19 on their education and on their social interactions. And even if they're only mildly or asymptomatic when they get COVID-19, they must self-isolate. And that obviously affects the children and also their families. And as has already been mentioned, COVID-19 vaccines are very highly effective at preventing COVID-19 infection and particularly severe infections, hospitalizations and death. Thinking then about the risks of the COVID-19 vaccines. So these COVID-19 vaccines have met very strict regulatory standards before they've been licensed by the European Medicines Agency. They've gone through all the same regulation and all the same testing as all other vaccines that we use. They continue to be monitored to ensure that they're safe and effective. So the common side effects that children as well as adults may find when they are vaccinated are things like pain and redness in the injection site, fatigue, muscle pains, headaches, and fevers. These are usually mild to moderate and resolve within 48 hours. There are very rare side effects of these mRNA vaccines, which are these inflammatory heart conditions, myocarditis and pericarditis, symptoms of which are palpitations, breathlessness, and chest pains. But those reported cases worldwide do resolve with rest and sometimes treatment. Cases tend to occur within 14 days of the vaccine, and they're more common after the second dose. And as I've said, the US have been vaccinating for a couple of months now, and the data from the US in 12 to 17-year-olds shows the risk of myocarditis in boys at 1 in 16,000 after a second dose and 1 in 100,000 in girls after a second dose. So how do you register? Well, registration is open on the HSE portal. The young person needs to be registered by their parent or guardian and need to provide their contact details and the child's PPSN. You can also register on HSE Live, and the vaccine is available in some participating pharmacies and GPs. If you register online, your appointment text will be sent to you very soon afterwards, and you will get a link to consent. So the consent for the child must be completed by the parent or legal guardian. What do you need to do for the appointment? Well, the children can't come alone. They must come with somebody, and ideally a parent or legal guardian. But if that parent or legal guardian isn't available, the child can be brought by somebody else. But in that case, the parent or legal guardian must have completed the consent before the appointment time. Please try and bring ID for the child, so something that shows their date of birth, so their passport or their birth certificate if possible. We'd recommend wearing a loose-fitting top or something with short sleeves because we need to be able to vaccinate them quite high up in the arm. It's important to have breakfast or lunch before an appointment and have plenty of fluids, particularly in this warmer weather, to make sure that to reduce the risk of the child fainting. And if parents have children who need additional support with their vaccinations, it's important that they know to phone HSE Live and request an appointment at a quieter time of day when that can be facilitated. So there are some frequently asked questions for parents that they're thinking about at this time. We also know young people in the first year of second-level schools are offered the HPV vaccine, the tetanus booster, and the meningococcal vaccine, MenACWY. So some young people who were in first year last year will have been attending catch-up clinics over the summer, and some going into first year, or all those going into first year of second level just coming up in September, are going to be offered these vaccines from October. It's important to be reassured that there's no need to leave any interval, particularly between the COVID-19 vaccines and any other vaccines. So we would encourage young people to attend for the COVID vaccine and also to attend for their HPV, their Tdap, or their meningitis vaccine whenever that is offered to them, either this summer or coming into the next school year. Another question we get asked is around fertility. Well, there's no evidence that these vaccines affect fertility, and there's no evidence that the vaccine can affect menstrual cycles either. These are mRNA vaccines. The mRNA in the vaccine is quickly broken down and doesn't become part of the body. And we are very much strongly encouraging pregnant women in the stages of pregnancy between 14 and 36 weeks to get the COVID-19 vaccine. Many pregnant women have already got the mRNA vaccines, and there have been no unexpected side effects to the mother or their baby. And we do know there are quite serious consequences for some pregnant women with COVID-19. So very important pregnant women come forward for the vaccines as well. So that was all that I was wanting to cover, but just to remind parents that there is a lot of information on the HSE website, and that's just a picture of the leaflet that which gives a lot more information for them. Thank you.
Thank you, Lucy. So I'll just bring you briefly through some data in terms of current trends in hospitals and particularly relating to emergency departments. And you can see the red line there is the trend in attendances, which for the last number of weeks has been higher than heretofore, and just in this week has come down a small bit. Admissions also have been running level with 2019 levels, and only in the last week have come down a little bit. And again, if you condense that into an 8-week view, you can see attendances and admission patterns. And to reflect on what Paul was indicating, attendances have actually been up, and that's reflective of, I think, some underlying changes in referral patterns. The ED attendances for over 75s are up significantly and remain so, even though there is a downward trend. And admissions likewise. And that puts a lot of pressure on the hospital systems in terms of service response, and clearly it's meeting a service need. And again, if you look at that over 8 weeks, the same trend is highlighted. So patient experience time has been running reasonably flat, disimproving slightly with the growth in attendances and admissions, but running reasonably flat, and in fact had improved significantly during the pandemic. The 8 a.m. trolley count, the red line there is the 2021 year, and you see that the trolley count actually is down against 2019. 2020 being a complete outlier in terms of there were significant numbers of empty beds in the system at that stage as we were responding to the pandemic at one of its early peaks. Parts of the country where there has been particular pressure, even in the last week, Cork, Galway, Mayo, Sligo, Naas and Tala. In fact, today, a lot of those sites are doing better in terms of their trolley numbers, but they have seen very high presentations, some well ahead of 2019 levels, which would have been the last normal year of activity we would have seen. COVID hospitalised cases, the CEO has covered, so I won't delay on that. And the daily confirmed cases, likewise, you can see there is an upward trend in cases confirmed. And ICU admissions also an upward trend. Again, CEO referred to this, so I won't delay on it, but total cases and confirmed cases vaccinated is visible in that slide. National Ambulance Service data, which is predictive of what's happening in the system. It's a bit small, so sorry about that, but the left side image is showing that the red dots are trends beyond what has been previously experienced, and we've come back to more normal trends in the last few days, and that's very good news. In terms of total transports from the ambulance service, that still remains very high. Overall summary is that the emergency departments clearly are open and dealing with emergencies. Services are being well attended. Additional information is available on our website and indeed in our IT service desk. So thank you very much. I'll hand over to Niamh. Thank you.
Good afternoon, everybody. So we've been testing and contact tracing now for over 16 months. And in that time, we have conducted over 6.2 million tests and made 1.5 million contact tracing calls. We are continuing to see a very strong demand for testing and tracing around the country. In the last 7 days, demand has increased by 12%, although it does sit still within our capacity. We conducted over 132,000 tests, and 92% of people can get a test in less than 24 hours. We continue to use pop-ups to enhance testing capacity in areas of need. This week, they're in Dublin and Blanchardstown, Tala and Sandymount, Donegal and Buncrana, and in Athlone and Dundalk. On average, we are doing about 15,000 tests in our community sites throughout the week. In the last week, positivity levels within the community site stand at 14%, with some sites reaching in excess of 30%. People aged between 15 and 24 hold our highest positivity level at 22%, which is closely followed by the 25 to 34-year-olds at about 17%. At the moment, in contact tracing, we have just under 1,000 staff working in tracing. It remains very, very busy in contact tracing centres. There are to manage between 1,500 and 2,000 cases a day. In the last 7 days, we've made 11,000 calls to index cases positive patients and 28,000 calls to close contacts. Both of these numbers have increased on the prior week by 22% and 16% respectively. During the week, we launched our List Your Contacts portal. This enables faster tracing, quicker notification to close contacts, and shortens the calls with positive cases. All in all, while it gathers the same information that we have always gathered, it does help us reach people more quickly. Yesterday was the first time we sent this link out in the texts to people to let them know they're COVID positive, and about 10% of people clicked the link. This morning, that number stands at about 30%, and this is really helpful as it reduces the times of calling people. As it stands today, 45% now of close contacts are fully vaccinated, and a further 11% have received 2 doses but not yet considered fully vaccinated. This number, as you will see, continues to rise week on week. It's a very positive trend. Close contact positivity this week has risen to 16.4%, and household is back to being both the highest type of close contact at 45% and the highest level of positivity at 21%. We're continuing with our antigen studies that started earlier this month and will continue for the next number of weeks. Self-testing has begun in third level institutions and also in early years in creches. So far, there have been no detected cases in these settings, but we will continue to report that as the numbers grow in the coming weeks. For antigen, we're also designing a new portal or application to gather antigen test results, and we should know further in this week what that will start to look like and when it will be available. The idea is for anyone who is part of any of our antigen testing pilots or a general member of the public who uses an antigen test will be able to log on, report this result, and we'll get a link then to be able to book their PCR test to confirm the result. Today, I would like to make a special note of thanks to our UCD Contact Tracing Centre. UCD was the first contact tracing centre to open in March 2020, and today the staff transition into the HSC site in central Dublin. I visited UCD yesterday and was really delighted to see there was so many people there who had begun testing and tracing back in March 2020. There is tremendous knowledge and insight built up in this team over the last 16 months, and I'm delighted they're going to stay with us and transition to the new location. We really appreciate the commitment of the staff in UCD, the college leadership and the clinical leadership that has been provided by Professor Mary Codd, Professor Patrick Wall and Professor Eamon Gormley. We appreciate everything they've done for tracing and reducing the onward spread of the disease. As final messages for testing and tracing, we continue to ask people to come forward for testing and to engage as soon as they possibly can with our contact tracing teams. We urge you to take that call and try not to defer it to a later time or to switch off your phone. We do have increasing levels of fully vaccinated people who do test positive for COVID-19, and this is inspected as we grow the number of people vaccinated. But what it does mean is if you are vaccinated and you have symptoms, you do need to come forward for a test as soon as you possibly can and not attend social gatherings, public transport, sports, training, or go to work. Thanks very much.
Thank you very much, Niamh. Questions? And yes, Fergal.
Good afternoon, Fergal Bowers, RTE News. My first question of 3. First one is, I suppose, for Liam Woods. To what degree are acute hospitals now back to relative normality despite the COVID-19 pressures? So what I mean by that is, can you give me maybe a sense of what percentage of hospital care is now non-COVID care? You know, normally before COVID it would be 100%. So how close and what percentage roughly is COVID care? Just a sense of what that is.
Okay, I think 2 different factors there. Firstly, in terms of returning to normality post-COVID, that's not happening now and won't happen for some time really. I think the lived experience of working and being in a hospital is very different now compared to what it might have been in 2019. So all the infection prevention and control measures and isolation requirements that have been in place for the last number of months remain in place. In terms of volume of activity, as the CEO said, we've 219 people in hospital today, and so we started the year with a bed base of 11,000 beds. So just in proportionate terms, you can see what that represents. But I think that belies the fact that the infection prevention requirements and the isolation requirements associated with treating patients with COVID, and the requirements for multiple flow channels through emergency departments and other areas remain very much in place. So I think the impact remains high, even though the numbers actually, compared to what we have seen before, are relatively speaking low and rising slowly.
And, I suppose perhaps also for yourself, Liam Woods, in the winter season just past, I mean, we could see from the HPSC data that there was effectively really no flu, no influenza. Now, if people continue to wear masks over the coming period, over the autumn, winter period now, whether, required, recommended, or just voluntarily do it, can't we expect that respiratory illnesses would be kept very, very low again, and that would be beneficial? Wouldn't that be a natural expectation?
So the impact of flu this winter at this stage, Fergal, is hard to predict. Clearly, there'll be a flu vaccination campaign rolling out from mid to late September, and that will proceed in the way it has in previous years. Yes, infection prevention control measures, hand washing, mask wearing, physical distance, will all contribute to lower rates of infection, but we are very dependent on the type of flu that comes to us. And also the impact of RSV, which often hits earlier, so respiratory virus that normally actually impacts on children. So we are to some extent held hostage by the particular strain that hits us. And yes, of course, effective infection prevention control measures will assist.
And I mean, perhaps for Paul Reid, perhaps maybe, or if someone else wants to answer this, and my final question is, we're obviously mostly really only using mRNA jabs now at this stage, I think. I mean, effectively, aren't we? So what's the HC doing with vaccines that are not using? And do you have many vaccines that are about to, or that have already gone out of date? And, what are you doing about that? And what sort of numbers might we be talking about there?
Just on the first part of your question, Fergal, through the EU process, we have procured up to 17 million of the various types of vaccines. And you're quite correct, the primary use of vaccines now are the mRNA and will be likely going forward. The position in terms of what use will be found for other ones is ultimately a policy decision for government. And they indeed have no doubt, and government officials will be talking through the EU process in terms of any potential surplus vaccines and the best use of them to protect across the world and probably developing countries. But ultimately a policy decision for government. On the
Going out of date, I mean,
yeah, and in terms of
have some of them have you already out of date?
No.
Are they about to go out of date?
No, just in terms of the second part of the question, we've always had a very tight process in terms of delivery, logistic chain, supply lines, and distribution. And that's where we've been prioritising the use of the vaccines to the various age groups and various populations to date. Inevitably, at some point in time, some of our vaccines will be surplus. We don't want to get to a point where it's of any significant number, and that's where we will implement whatever government policy decision for the use of any potential stored vaccines, but it's a very small number, if any, at the moment.
Is it fair enough to say that at this point in time, no vaccines have been allowed to go out of date? Or
Lucy, do you want to make any comment?
I wouldn't be able to put an exact figure on it now, but yes, very, very low numbers. I mean, this is something that we would do with all our vaccine programs. We keep a very close eye on expiry date, and as has already been said, it's a first expired, first out to the sites. The way that we would deliver the vaccines, we're delivering them very frequently to make sure that they don't run out of date as best we can, and to make sure that there's a good turnover in the sites.
And we have on occasions, some pharmacies may not have the use of them, and other pharmacies are looking for more. So we've redistributed even between pharmacies, particularly on the Janssen vaccine.
Paul Quinn, Virgin Media News. Lucy, can I just ask you, first of all, do we know how many other countries and which countries are administering vaccines to 12 to 15-year-olds? And are there countries perhaps that aren't doing it that do have supplies, and maybe why they're not doing it?
So there's quite a number of countries. Off the top of my head, I don't have the exact list. It's around 10 in Europe. There's Canada, there's America, and there's Israel. I believe Israel have just licensed the Pfizer vaccine now for the 5 to 11-year-olds as well. So there's quite a lot of countries doing it for universal. children 12 and above, and then there are some like the United Kingdom who are offering it to those who have risk conditions or who live with someone with high-risk conditions, who are the people we're particularly also recommending to come forward. So I suppose it's different priorities in terms of the disease, how much vaccine they have available. So it's obviously, as with all vaccine programs, they do vary across different countries, and it's the expert advisory committee in each of those countries that make those decisions.
You mentioned there, Paul, 42,000 children aged between 12 and 15 have now registered. Is that where you thought this was going to be in the early stages? And how many vaccines do you expect to administer this weekend to children? And then just the other one, is there any plans at all to administer vaccines to children under the age of 12?
You take the last part, yeah, go ahead.
So there's around 280,000 children in the age cohort. Obviously, although the portal did launch last night, it was only really to be sort of advertised for this morning. So there's probably a lot of parents that are going on today, tomorrow, or making those decisions over the next few days. So we will be offering appointments very quickly to those people. So in terms of exactly how many will be vaccinated over the weekend, we'll only really be able to say next week, but we would try and get to as many of those people as we possibly can. And in terms of younger age groups, the European Medicines Agency haven't yet licensed Pfizer for the underage. So that was Israel have to have their own medicines licensing agency, and they've licensed that themselves. But when that is licensed, again, that will be something that needs to be considered by the National Immunisation Advisory Committee, and then we will take advice on the policy of that if that happens.
Sorry, Paul. Sorry, Lucy. Just on the first part, the 40-odd thousand that have been registered this morning, what we've seen with every element of the ages we've walked through has been a significant registration on the first day, etc., but a steady registration for each of the days over the next couple of weeks. So we're pleasantly surprised. It's a good registration straight up in the first few hours, but we do expect it to look consistent like the pattern we've seen before. People registering, many days after launch, in fact, many weeks after in some cases. So, and we are utilising the weekend, any potential available slots over the weekend to administer 12 to 15-year-olds, and we're well aware many people have got appointments already. But we are also continuing the dose 1s and dose 2s for the other age groups in the vaccination centres too. And finally, we do expect to have extended hours, and we'll give some further information on that as well to support parents for bringing children into the vaccination centres too.
Can I just ask you briefly about maternity services? Last week, I think yourself and Colm Henry were saying that, all 19 maternity units were following the guidelines. In the last couple of days, we've seen this whole controversy again, the Master of the Rotunda out defending the position that they have in their hospital. We've been speaking to partners, dads sitting out in cars again who aren't able to go into the hospital. Like, what's going on? Why is there such a disconnect between what the HSE say, what the hospitals are saying, and then what families and pregnant women and their partners are having to deal with on the ground?
Yeah, just 3 quick messages, and I'll ask my colleague Liam Woods, who's been talking today to the hospital groups just in relation to compliance levels. I think we can give you this kind of summary update. The first thing to say, I think, when you heard the Master of the Rotunda, there's a few important messages in what he's been communicating out on. And first is very real safety concerns that they have, legitimate safety concerns that they have, particularly with the infrastructure that they're dealing with. And I fully support the challenges that they have in the Rotunda in particular. So I think that's an important first. And we indeed have been saying that here every week, that there is a significant challenge. The second point in terms of the Rotunda, I think if you go through their statement, indeed what the Master's communicating on is they are implementing the measures that we've set out, the 7 measures that were set out in the circular. What they are being very clear about, some other measures, particularly in terms of outpatients and the infrastructure that they have, it's impossible for them to move towards some of that. So I think they are significantly compliant with a lot of the guidance we gave, but they are being very clear. And we have asked the hospitals to be upfront and communicate with us when they do a risk assessment, so we can communicate it out publicly as well. So, I just want to put that in around significant risks, which are well highlighted. Second, some of the infrastructural issues that they have to deal with. And thirdly, we have asked hospitals, the 19 maternity hospitals, to, upfront and early notify us when they've done a risk assessment of what impacts that they have to work through. And I ask Liam to give some further detail on that too.
Units, and we've, as of yesterday evening, we checked with the 6 hospital groups the status of implementation, and most maternity hospitals are reporting as compliant with all requirements, including the extended ones. There are some exceptions. So of the 19, 14 will be fully compliant by this weekend. There's a couple where they're making physical space changes within the hospital to facilitate visitations. And then, as you've seen there's a couple of sites, Rotunda being one, where the physical limitations are such that it's very difficult to fully comply. Though they have said on a compassionate basis, or where difficult news is being delivered, they are facilitating arrangements for a partner to be present. So, and the main criterion that's causing difficulty where we have got residual issues is the physical infrastructure. So there's a couple of sites where that's been worked on. We've 2 or 3 sites that will continue to have physical infrastructure problems. The overall guideline, of course, will remain under review anyway based on the progression of the pandemic, and that's something that we'll continue to look at. But right now, that's the position. So most units are compliant. Where we have limits, they are to do with physical infrastructure.
Paul Cullen from the Irish Times. A few quick questions about data. Do we have a figure for the number of cases of this inflammatory system disease affecting children, and anything about outcomes? I did ask the press office during the week. I didn't get any response. And do we have any data? You presented data about the vaccination status of people in hospital and ICUs. Do we have any more granular data about the outcomes in relation to specific vaccines?
I might just ask Lucy on the first one for you. On the second one, Paul, the data that we've had has gone in quite a level of granularity. And a lot of it is a manual count and a manual reporting back on a daily basis to us. We do expect to have a lot of that automated over the next few weeks, where we'll be in a position to publish it. But we will be reporting here weekly, as I said previously, on all that data and answering any of those questions. Specifically, right, the breakdown of the vaccine type, I don't have it to hand, and we haven't captured that right now. Of the vaccines, the vaccine status, if you like, and hospitalized cases, ICU cases, and mortality. I don't have a breakdown between vaccine types.
Yes, we're taking from the guidelines. There's some information here from the UK, and that is that there were 5 per 10,000 infected children who developed the multi-system inflammatory disease with a case fatality rate of around 1%. But that's data from the UK. There's small numbers, I think, in this country.
But when I last asked about this in February, the HSE press office was able to give me a figure for the number of Irish cases. So do we have an updated number for the Irish cases?
Yeah, but we can see if we can get one for you.
You are listing this as under a separate category from other possible side effects that children may experience. So it's not clear to me why it's being considered separately. You said that young adolescent boys had a 1 in 12,000 chance of myocarditis.
16,000. Data from America, yeah.
16,000. And yet the age group have a 1 in 100,000 chance, risk, healthy ones, at COVID. It seems to suggest then that the risk of this heart condition or cardiac-related condition is far greater for young adolescent boys than the risk of COVID.
So the raw numbers are like that, but in terms of myocarditis and pericarditis, it's more common after a second dose, but it does resolve. These conditions with some rest, they do resolve and possibly hospital treatment. And obviously we know COVID-19 disease also may result in hospitalization. All children will have to self-isolate at home. So it really is a balanced decision for the parents to be making. And that's why we're being upfront about this information and making sure that people are aware of the information when they're getting their children vaccinated, so they understand the risks and benefits and make the right decision for their children.
Just to clarify, when you say there's a 1 in 100,000 risk of a healthy child in this age group from COVID, there isn't any great difference between the sexes there, is there, in that risk? Is there,
no.
that you're aware of? Yeah.
No,
so
not
it's
that I'm
roughly
aware of.
around the
Yeah.
same. So then you can compare that figure to the boys' figure that you provided for myocarditis, and it is 6 times higher for the vaccine risk.
Yeah, so that's early data from America, and obviously there'll be more data that we'll be able to gather.
I know Lucy said it, but Lucy did list other impacts on children through COVID, whether it's isolation, whether it's psychosocial impacts. I think you listed some wider ones as well. We're just encouraging people to see it all on the round.
Shauna Bowers with the Irish Examiner. Just that figure that Paul was talking about, 1 in 100,000, is that population or is that 1 in 100,000 of those who are infected? There's a bit of confusion around that on social media at the minute.
Okay, so 1 in 100,000 comes from, that is data from hospitalization rates in Ireland, 1 in 100,000 people 0 to 19, and that's healthy children without underlying conditions.
So for every 100,000 children who contract COVID, one of those is hospitalised, or for every 100,000 children in Ireland, one of
for
those?
every 100,000 healthy children in Ireland, 0 to 19, it's one was hospitalised.
Surely then the number, like the proportion of children with COVID, like taking the population out of the equation, is higher than 1 in 100,000.
So those are the healthy children, and then there are the children with risk conditions where the risk of hospitalisation is much higher. So 7 out of 10 children who are hospitalised have risk conditions. The 1 in 100,000 is healthy children without risk conditions.
Sorry, just trying to clarify this slightly more. So 1 in 100,000 healthy children in the population, but not 1 in 100,000 healthy children who have COVID.
No, in the population. Then 1 in 100,000 children in the population are hospitalised when they get COVID.
Do you have the figure for those healthy children who have COVID who are hospitalised, as in percentage-wise?
The other way around. We'd have to get that for you. We'll get that clarified for you. There have been around 90 children in Ireland, 12 to 15, who have been admitted to hospital, though, if that helps.
One more question. The World Health Organization last week kind of called for a moratorium on booster jabs until the end of September, I believe it was. Is that something we will be abiding by, or are there current plans to administer booster before the end of September?
We are waiting on clarification and further guidance from the National Immunisation Advisory Committee ourselves. What they have advised previously a few weeks ago was to prepare the planning, scenario planning, which we are doing for booster campaigns in conjunction with flu. We haven't triggered a date that would start. And we'll await guidance from NIAC in terms of commencement date. So we haven't planned it to start before it. We'll wait guidance.
Yeah, I'm just wondering, in relation to the vaccine cert, how are we getting on with recognising certs from Northern Ireland? I had some contact from some people who are having difficulties getting this translated over here. And obviously there are people who are working on one side of the border, living on one side of the border, working on the other, or who may have moved from one side of the other border to the other.
Yeah, Paul, just two things. One, HSE are not administering the vaccine cert. We are processing submitting some of the data. I did hear the Minister, Oisin Smith, on this morning talking about that was the next phase of the solutions they were working on for people in the north of Ireland. He wasn't able to commit a date this morning, but he did say it was one they wanted to solve and planned to solve.
Is it?
It's the Minister Oisin Smith.
Sorry about that. Yeah. Oh no, it's that department, is it?
Yeah, he's overall leading across government departments.
And sorry, just something I was writing about this morning as well. I mean, you were talking about very interesting data here just now about risks, for example, and so on. But when are we going to have a regular flow of information? When is the HBSC going to start those weekly reports that they've stopped doing since the ransomware attack? It's, you know, I mean, how can we possibly deal with this kind of challenge of the pandemic unless we have proper data? And it's not just the people like you who seem to have access to a lot more data than we have at the moment. It's now 3 months on from the ransomware attack, you know, so it's a reasonable period to say surely normal service should be resumed very shortly.
Yeah, just a few responses, Paul. First of all, we're here every week and we'll continue to be here every week and answer all questions that we have data for. Second, the piece of data which I produced today, we've been working on for the past couple of weeks, which is to try to get further insight and depth on vaccination programme. We do hope and expect to have that automated in the next couple of weeks. Specifically related to HPSC data, yes, they have been significantly impacted by the cyber attack and integration between themselves and particularly the public health teams who do a lot of manual assessment data. But if you look at what the HPSC, they do have now the daily report on 14-day incidents. They are reporting on a weekly basis deaths, and that was nothing related to the cyber attack, Paul. That was related to their planned approach to reporting on deaths on a weekly basis, because A, deaths have reduced significantly, and B, there was probably not great meaning to be interpreted by numbers of deaths today, numbers of deaths tomorrow. So that is now a weekly report. Their daily 14 instance report is there. And the final one, which they have up, which is a breakdown of the breakdown of cases, outbreaks, which is there to some level right now. And they have said it'll be fully there from the week commencing 23rd of August. So a lot of their daily reports are there. Their deaths have moved to weekly, and that was a plan separate to COVID. And some of the reports will be there from the 23rd. And we've produced as much data as we possibly have our hands on here today.
And just what about waiting list data and the NTPF? Is that there?
Yeah.
Presumably rely on information from you guys.
Yeah.
But they do extract information from the HSE to produce their waiting lists. I think they're looking to recommence in the next couple of weeks, Paul. I'm not sure now, but we'll confirm that. But I think that's what they're after.
Paul O'Donoghue from News Talk. Sorry, just to ask, I might have been said and I might have missed it. Is there a figure on how many 12 to 15-year-olds have registered so far?
Yeah, I gave it, I think it's 41,000. Yeah, it's more than that. Vast majority were online. It was just 700 through the phone system, call centre.
And just ask as well, are there any plans to further extend vaccinations to children aged below 12?
So it's not licensed by the European Medicines Agency yet, so we would have to wait for that license and then await for NIAC guidance after that. So not currently.
Is it something that the HSE might consider, that NIAC might consider?
It's something that the company are putting together information. I know they are testing it in younger children, so we would have to go through those periods to test. They would have to get licensed by the European Medicines Agency. NIAC would consider it, and then we would see if that was a policy decision by the Department of Health. So there's a few stages to go through until that would be something that would be done.
Would it be an eventual aim, presumably, of the vaccination programme? I know it's not something that we control here in Ireland, but is it something that I suppose we would like to do to get the entire population covered by vaccines, if possible?
I think it would be something that we would need to see the information from the companies and the information as things go on, whether it would be licensed.
2,000.
And yeah, sorry, just to clarify as well, Paul, on you were saying earlier that 92% of people who are in hospital with COVID are being treated for COVID. I think you mentioned, I think it was 2 weeks ago, a figure of 70% for that same thing. So I suppose just why the difference there, and where exactly is that figure coming from? Was this an internal report done by the HSE, and how was it carried out?
Okay, so the last part of your question first, Paul. All of the data which I presented today is returns from the hospital system, from each of the hospitals to our central reporting system here. It's pretty much a manual process right now, but it's them reporting back on vaccination status, age, etc. So that's where the data is coming from. We will be in a position to produce that weekly, very shortly. That's where the data is coming from. On the 92% being treated with COVID, it's a combination of those people who were admitted with COVID and also a combination of those who may have contracted through an outbreak in a hospital setting. So, for example, in Mayo a couple of weeks ago, and are being treated, and other people who have come in with an illness and are being treated for COVID as well. So the 8% are those people who are asymptomatic and not infectious.
And sorry, just the reason why it, I suppose, increased from 70% about 2 weeks ago or so. Like, does that number tend to fluctuate much week on week?
Yeah, I think it will. But again, this is a snapshot of a week, and we'll see ranges in it overall. But again, I just think just between the 70% and 90%, that we've captured a lot more granularity of those people who may have been subject or contracted COVID through an outbreak. and are infectious and symptomatic, and other people who come in for another illness and are symptomatic as well. So it's a bit more detail of the other 30% that may have given a total 92% that are symptomatic, infectious, and being treated for COVID.
Can't do anything about the rain outside, no. Just another one on the maternity services. I know there's a campaign group calling for better maternity care, and one of the things they're looking for is perhaps that partners could be tested before they go into a hospital, either antigen or PCR testing. Is that something that would be looked at? And I know that they want a kind of a roadmap by the end of this month on how they go forward and how partners are not excluded in any circumstances. Obviously, you've mentioned there that I think 14 of the 19 hospitals will be compliant by the weekend, and there's issues, of course, around infrastructure. But are we never going to get to a place where it'll just be normal for partners to be with their wives or their girlfriends or whatever in those settings?
Just the first bit of your question, Paul. I mean, I welcome that call that came just about finding a roadmap, because I think that's the way we would like to move forward as well, with patient representative groups that we have already engaged on, and trying to see that roadmap. I think that will be valuable for all of us. The second part of the question is, when are we going to be normal? I don't expect that we're going to be normal with COVID, and Liam touched on this earlier on, not just in relation to maternity services, but in relation to threat in our hospitals for some time to come yet. Even though we're through the vaccination programme, we're still going to have dual pathways for COVID and non-COVID care, So, I think finding a roadmap would be good, but we will be misleading to say we can predict when we're going to be normal, because we don't know. And I think the one thing about COVID throughout all of this, it's caught us by surprise. At every stage, we thought we were close to normal. And we are closer now with vaccinations, you'd expect. But I just want to put that on the record. It's very hard to predict when is normal for our hospitals. I wish we could. But I do value this issue about trying to find, our suggestion of trying to find, particularly in relation to maternity. And that's something I'm going to be talking with the Chief Clinical Officer about very shortly.
The antigen, PCR?
All of those are in the mix. And I think, as Liam said, at different stages of the transmission levels in the community, different solutions may offer themselves, whether that's testing, whether it's vaccination, and we're willing to look at all of them. Liam?
Published on the HPSC website, it doesn't require, there isn't a requirement for information on vaccination status or testing indeed. Being a contact or being symptomatic clearly are referred to as reasons not to attend a hospital. So in fact, the environment at the moment is more, is facilitating to the greatest extent possible visiting without having a precondition of testing and vaccination. I think, to your point, could it facilitate further flexibility? That's a question I think that we'll review as the guidelines develop and as the total level of vaccination in the population and in maternity environments grows. But I think that will be one for our Chief Clinical Officer and clinicians to consider as the evidence develops.
Thanks for your patience. We know now that the vaccines don't prevent onward transmission, at least to some extent, of the disease. Maybe it was in the slides, maybe I missed it, but what is the latest trends in terms of outbreaks in at-risk areas, particularly nursing homes? And are there any plans to modify current policy in the light of that evidence about onward transmission, for example, by reintroducing serial testing or by making visiting restrictions tougher again?
Just ask Niamh.
In terms of outbreaks, Paul, the latest reports I would have would indicate, I think the figure is 4 outbreaks in nursing home environments, so I'd need to update on that. Low numbers of cases, and at the moment, almost no hospital admissions, though that will be watched carefully. And in the hospital environment, there are 11 outbreaks, but most of those are 1 or 2, 2 or 3 cases. 3 sites account for over 70% of all the patients and staff impacted. So we're still seeing relatively low levels of outbreak and relatively low impact, though of course it's something we'll have to watch. There's no intention at this stage to review visiting policy around outbreaks. That's not indicated at present.
On serial testing, so we did ask the clinical teams to review that position. As a testing system, we would be available to continue to do serial testing if it was required. So it's under review. It's certainly not planned in the very short term, but it is being looked at. And the status of close contacts. As you know, we don't automatically test people who are close contacts who are fully vaccinated. That was reviewed this week, and the decision was to maintain as it is currently, which is people who are close contacts and fully vaccinated don't have to restrict their movements and do not automatically have to go for testing unless they're symptomatic.
Sorry, just which of the 3 hospitals with the majority of the outbreaks?
I was afraid you might ask me that, Paul. All right, yeah. I'll tell you in a moment. We can go on. Read an email now, Paul. Talis, Sligo and UL.
Thank you very much, and we'll see you next week.